Now, this may sound familiar to you. You're having trouble losing weight, you're lacking energy, and you have trouble sleeping. So what's wrong with you?
Well, our first guest this morning says your hormones could be to blame. Welcome, Dr. Tunis Hunt with Hunt for Wellness. This is going to be a great topic. Hello, how you doing? Welcome to the show.
I'm doing well, Eugene. Thanks for having me.
Unfortunately, I think a lot of people can relate to this as we say that. I think a lot of people think, yeah, I'm tired and I don't sleep well and I can't lose weight.
Right.
We hear the word hormones mentioned quite a bit. What exactly are they and what role do they play in our overall health?
Sure. Hormones are the chemical messengers in our bodies. They're made by organs and glands, and they travel to other areas of the bodies and really communicate signals. For instance, there's an area in our brain called the pituitary, and it makes a hormone called thyroid stimulating hormone, and that's what tells our thyroid to make hormone. Or vitamin D from our skin can actually travel through the body and tell our body to absorb calcium. And so those are just two of the thousands of processes that hormones are responsible for, and so a very vitalistic and important role in our body.
Now, these things are responsible for, but how do we know when they're out of balance?
Sure. Well, because they affect so many areas of the body, a lot of symptoms can be very clear signs that our hormones aren't working. Some of the more prevalent ones that we usually hear are the inability to lose weight, the weight loss struggles with the diet and exercise, low libido, constipation, erectile dysfunction. These are all big things. And then women, certainly hot flashes, menopausal problems, and so forth, can all be pretty prevalent hormonal problems.
And so obviously it's not just a problem for women, it's a problem for men as well.
Yeah, and that's a great point, Colleen, because a lot of times we associate hormonal issues with females, and usually that is the case when it comes to diagnostic testing and so forth. But really, men, we struggle with hormonal problems just as much as women. You know, one of the #1 drugs today are low libido or erectile dysfunction problems, low T. We hear that a lot with men, and we suffer the same symptoms: the depression, the low energy, and so forth.
So how can we have our hormones tested then? How do we do that?
Yeah, so the good news is there's a couple ways of getting hormones tested, and each way adds its benefits and has its limitations. Certainly the most prevalent kind is the serum testing or the blood testing, and that's typically what our doctors do, whether it's our endocrinologist, OB-GYN, regular physician, or so forth. But the limitation there is it doesn't look at some of the free forms or the metabolites of the hormones, and so salivary testing or even urinary testing can be very valuable at looking at some of those other components of the hormones and really give you more of a functional or a proactive approach when it comes to hormone testing.
Well, let's talk about treatment. What are treatment options? How do you get better?
Yeah, so well, we probably have all heard of hormone replacement therapy, and that simply is one of the more prevalent ones and ways of doing it. So whether or not you've been tested through your blood, serum, urine, whatever, and been given a diagnosis of a deficiency, you can add either synthetic or bioidentical hormones, and that can go a long way of helping with some symptom relief. But unfortunately, if it's not maybe getting to that root cause, that underlying condition, you'll find yourself constantly battling with hormonal symptoms despite the medications, despite the hormone replacement. A lot of women specifically, when they come to our office, are often complaining, hey doc, I've been on this bioidentical or these hormone replacements for years, and my doctor's constantly changing the dosage and this and that, and I still have these symptoms. Well, it's because maybe some of that root cause isn't being addressed just as it should be.
Well, could some of that root cause be lifestyle?
Yeah, and that's another great point. The good news about our bodies is it's intelligently designed, and if you give it what it needs and you take away what it doesn't need, it does a pretty good job of healing. And so, yeah, lifestyle goes a long way. 95% of our current health condition is more of our choices than our genetics, and so things like putting the right foods in our body, the right minerals, nutrients, and vitamins, staying away from some of the stuff that we should stay away from, you know, the artificial colors, sweeteners, and so forth. Exercise is an excellent way of kind of boosting testosterone, boosting cortisol, boosting some of the things in our bodies, and then certainly getting rest, relaxation, and looking out for stress, which is really the kind of that silent killer when it comes to our overall health.
Just a note about stress. It's certainly something that affects our hormones. And to help with the stress part, you wrote the Adrenal Code, and viewers can download it for free right now. If you go to the website that's on your screen, theadrenalcode.com, theadrenalcode.com. Again, download that for free. Find out more about how stress is affecting your health. You also, Dr. Hunt, host free dinner talks, and you have some coming up this month.
Yeah, we do. We have them every month. We find that that's really one of the most effective and fun ways of teaching people about health, nutrition, what they can be doing in their own lives to not only benefit their health, but their family's health. So if you're interested, yes, come to one of our dinners. We'd love to have anybody and everybody interested.
Why wouldn't you take advantage of that? To register for the free dinner talk, visit freedinnertalk.com, freedinnertalk.com, or call Hunt for Wellness, 704-588-1792. Again, 704-588-1792 is the number to call. Dr. Tunis Hunt, thank you very much.
Thank you very much, sir.
My pleasure. Good talking to you.
All right.